Well, hello everybody. I'm Andrew David, editor-at-large Elemental, and I'm delighted to introduce the second of this week's webinars, which home in on decarbonisation in the healthcare sector. With this webinar, we're going to try and look at sustainability in the round and to widen the discussion a bit beyond heating and cooling, though I'm sure we'll be touching on that too, as it's a very important part. We're privileged today to have with us, at the moment, two people. We were hoping for three, but we'll come to that in a minute. We're very much in the thick of decarbonising. So joining us today, we have Richard Hilson, Principal Low Carbon Consultant at Gemserv, and Tassos Kougionis, who's Director of Sustainability at McBains. Ian Hinitt of Rotherham NHS Foundation Trusts, we're hoping to have with us, has some technical issues, and if we can't get him online or on the screen, we will have him online to in the chat, so he'll be involved even though we can't see him, I think. So the other thing I should say, you might hear that I'm losing my voice, and more so than ever, I will be allowing the panelists to do all the talking. I say that every time, and of course it's important that we have interaction, so I invite the audience to submit any questions via the Q&A button rather than the chat button, and please keep them short and succinct, your questions, or else we'll have all kinds of confusion. So panelists, let's begin with some introductions, which is where you share a little of your particular perspectives on the challenge of sustainability. And tradition has it that we go in alphabetical order, so that means Richard, you're on first, and then it's Tassos. I can hear a voice in the background. I don't know whether it's the one of you or whether it's someone trying to get in. If you can't hear that voice, we'll just proceed as normal. So Richard, you go first. So give us a little bit about where you're coming from and your perspective.
Thanks, Andrew, and delighted to be with you today. Yeah, my perspective has come from previously having not been within the health service or serving the healthcare sector. I worked originally for an energy efficiency project company, mostly looking at lighting, and this was nearly 10 years ago now, in the commercial sector, but also in the health sector and the education sector. And I think the evolution of the sustainability manager through that period has come, the clients that I was working with at that time and that I became as I moved into the NHS were moving from, they're very much based in the estates department, in the capital projects department, and everything was about reducing energy consumption. There wasn't a lot at that time, 10 years ago, on renewables. And then around probably 6 or 7 years ago, as I started, I went into work in the NHS and worked for Frimley NHS Foundation Trust. And even back then, kind of in 2017, 18, a lot of the focus was still around the direct emissions from NHS facilities and their fleets to some extent. But there was definitely a change both in the wider world and also within particular sectors in healthcare around the time of COVID. So much happened around the time of COVID. And my perspective has come from a much greater appreciation of our wider carbon footprint and environmental footprint, as well as the social impacts of everything that we do. And that really came to a head for me during COVID, where I saw the response that the NHS was providing to the pandemic, and worked in the operations centre within Frimley. The head of sustainability hat came off. And it's that point really when I really understood the connection between delivering great patient care, reaction, and also being proactive in planning for future events, and that balance between immediate projects and those programs that we want to deliver over the longer term, and that greater challenge. So with your title, it broadened my horizons on sustainability from that position of 10 years ago to a much broader position now.
And you've gone from gamekeeper to poacher, I guess.
Yeah.
What's the new role, or the current role? How does that pan out just for the audience's benefit?
Yeah, thanks. So I've been with Gemserv for 2 years and joined having been head of sustainability at Frimley Health for just under 5 years. And my role now is supporting both NHS trusts, but also particularly the independent sector, which is growing and is being relied on and commissioned more by the NHS itself to establish carbon reduction plans and wider green plans and sustainability strategies, which encompasses all of the areas of carbon emissions, both building and fleet related, but also across procurement, employee commuting, business travel, etc. The whole area, and as well as advising some of the businesses and the players in the markets, feeding into the decarbonisation journey of the public sector and the wider private sector.
Well, I'm sure we'll get into some of that wider world of carbon emissions shortly. So let me hand over to Tassos and get your view on McBain's view of the world.
Hi, Andrew. Hi, Richard. Hi, audience. My name is Tassos Kougionis, and as Andrew described me, I'm the director of ESG, Net Zero, and Sustainability at McBains. Before I describe the McBains view of sustainability of healthcare estates, I think it would be useful to explain my background and how I actually, operate within that sector. I have started working on net zero standards since the early days of the Zero Carbon Hub. Initially, my focus was the residential sector, but gradually and steadily, we came to the realization that the contribution of each sector to environmental impact can be substantial, and therefore I naturally progressed through the different sectors. I'm a structural engineer, that's my academic background, but for a number of years I have been working on policy development or evidence development for policy development for government departments, local authorities, and setting standards for private clients. I engaged with the NHS initially through some exposure I have received from the Monkland's new hospital program when we're discussing maybe 4 or 5 years ago how we can actually adapt and develop the estate or the new building in order to satisfy specific requirements, and that those requirements would include sustainability and net zero mainly. And I would say through my experiences with the different sectors, the way that sustainability translates into my thinking is that of a best practice. It's all encompassing and people can be lost in terminological debates and changes of boundary conditions. But at the very end of every thinking should be, am I satisfying the client in terms of can they deliver the quality of services they expect to deliver? Can they minimize the impact they would have based on the kind of design elements of their project, usually construction projects, how it fulfills specific elements of sustainability and how it satisfies the element of resilience? Because what we're doing today is preventing or adapting to things that might happen in the future. And I think it's within the core thinking of the NHS that they're supporting vulnerable groups and patients. They need to deliver the best quality of services. They're a sensitive organization, very complex organization, but one of the most important estates. And part of the responsibility is also preventing some of these knock-on effects that the environmental impact might have on human health. So that is very important to them, and that's what we have seen with the Health and Safety Act that was introduced, the Healthcare Act that was introduced last year. So this is my experience. Since that time, I have worked on GOS, the Children's Cancer Center, and Brighton 3Ts, which is part of the new hospital program that I can explain a little bit more about later, with the practical implementation of what we describe as the different sustainability benchmarks to be. So that's where I come from. I have seen many different sectors. I think the NHS and the healthcare estates are some of the most important assets that a country can have. So it's very significant that we do the best we can.
Excellent, thank you, Tassos. Okay, so let's get into the detail a little bit. And, I've posed a few questions to the panel to get them thinking. And in my pessimistic mode, I said, as my first question, we're talking about widening the horizons, but can we, or should we just be homing in on tried and tested measures? What is the real prize? So, Richard, do you want to tackle that one first? Are we by talking about widening the horizons, are we being over optimistic, or is there lower hanging fruit to go for first?
I think one way we can look at widening the horizons is in delivering perhaps the low-hanging fruit, or delivering some of the tried and tested solutions, is expressing the benefits of some of those a little bit more, better, for want of a better word, in more detail. So I'm sure a lot of your audience is probably aware that in the process of bidding for work within the NHS, then installers and other parts of the supply chain will be filling in details in bids and tenders about their social value commitments, for example. We haven't been particularly good within systems, or definitely within trusts, at expressing all of the benefits, other than on the really big schemes where it's been part of the business case. So some of the simple measures that are being taken in NHS trusts and in wider local authorities, for example, some reduction in energy use, and also moving over to lower carbon vehicles or electric vehicles, and all those other measures will all have benefit to the local community. And I think so. One way of widening the horizons is getting much better at expressing our impact, the impact that those things are taking, the positive impact across the environment and across our local community, as well as more widely. And then secondly, widening the horizons is also delivering, for example, the sorts of projects that Tassos is involved in either new developments or large refurbishment, is really understanding how the embedded carbon and the reduction of waste, and the reduction of the increase of modular build ability to decommission at the end of life, all of those things being plugged in at the beginning, even on some of the smaller projects, will have a real difference to the NHS moving forward in 10 to 15 years' time, because undoubtedly facilities will be changing over the next 10 to 15 years rapidly, partially driven by both demand increase that's been left after COVID, but also with increasingly new models of care that are delivered through digital innovation. So that widening the horizon is thinking about the wider impacts of what we're doing at the beginning, at the design phase, as much as possible. And then the third element is kind of big picture widening again, is recognizing that the healthcare sector is about 4 to 5% of the UK's carbon emissions, and that figure is more or less replicated globally. And that is, a large part of that is everything that we buy in order to deliver healthcare, as well as all the travel involved and the energy consumed in that production. So there's a lot to think about, but breaking it up into, right, how can we express better what we're doing already, but be aware of the larger healthcare picture and impact, I think is a useful way to start to think about it. And talk to people in healthcare, talk to the clinicians, understand how passionate they are about reducing the environmental impact of delivering healthcare, and that brings together a really compelling story to widen those horizons.
Thanks, Richard. You've done the great panelist job of opening up several more questions, but we'll come to that in a minute. To Tassos,
Indeed,
scope,
Richard.
I'm sure you think there's scope for widening the horizons.
when we're scanning a horizon, what this practically means is that we have the ability to see a little bit further. It doesn't mean that we have to increase the complexity or increase the processes and bureaucratic elements. It means that we are actually reducing the risk because we can understand more about the from the angle that we're looking at this topic. And sustainability, somehow historically the concept has been associated with a lot of the times additional cost or some complexity or some admin work, but this was never what it was meant to be. The sustainability, the ability to sustain, to be able to actually provide for the generations to come in the future without compromising what you have today, includes the environmental element, the social element. By default, the healthcare estates, they deliver this kind of greater benefit in terms of the social value they bring together, and they can have opportunities to enhance this even further. There have been studies, for example, that access to green spaces, ability to control better the indoor thermal conditions can, reduce the patient time in a ward, or for other specialist uses that we evaluate. So I think widening the horizons when it comes to sustainability is identifying the benefit, describing the benefit, and communicating the benefit better. But sometimes the terms that we use, while very applicable for the commercial reality that we're experiencing, they're not the most effective. For example, quantifying the payback of an investment. What we have seen before is, for example, one would say, I give a very simple example, I'll move away. Why I need to spend £3 million for a heat pump? It's okay, it's a fair argument, But then how much you would have spent to replace your boiler system because it's at the end of life, or 2.5. So actually the extra over is 500,000. How much do you save of your annual energy bill of 50K? In 10 years you pay back. How much you have saved from, local communities that they would have been exposed to combustion of a gas system, and their health outcomes that you might actually, be required to support in the future. This we cannot quantify, but there is no question that applying and widening the horizons of sustainability as a concept leads to better or best engineering practice. For us engineers as well, it makes us think, it makes us innovate, break through. It's exportable knowledge as well for the UK. So I don't want to open up so many different discussion points, but it's always for the best when you can see a little bit further and maybe a little bit more clear as to where you want to go.
Okay, interesting. Now we were talking the other day about the risk and the cost. That's an important element, isn't it, to consider when we're looking at the sustainability. And I guess that's something you're really looking at in detail. It's weighing that against the opportunity, and risk is a big thing in healthcare. So, Richard, what do you think? I'm also aware that I've added this in as an extra thing. It's occurred to me how important risk should be. That's something we've got to address, I guess. Richard, do you want to go first on the whole subject of risk?
So certainly from the client's point of view, whether they are seated within the Estates and Capital Projects Department or seated as a clinician within a service delivery, risk is all about patient safety and reducing the risks of compromising that safety, and also then on the financial side, the spending has tended to veer towards increasing the quality of patient care, obviously in the direct delivery of that care, and reducing as much as possible potential risks going forward, whether those be immediate security related risks or risks in the delivery of care, or broader risks in the estate related to infrastructure and the interdependencies between different pieces of kit. And now I think without wanting to complicate things, then you've got risks that are emerging. The longer term risk in delivering a sustainable system of healthcare is that we do have carbon targets, net zero by 2050 across the UK. The NHS has set itself net zero for all emissions by 2045, and for the direct emissions that the estate is part of by 2040. So the NHS as an entity has a risk of not decarbonising quick enough, but at the same time there is also a risk to patient safety and a risk of increasing demand of healthcare going forward if some of the implementation of designs isn't correct at the beginning. And I'm going to just refer back to what one of the things that Tassos talked about is, while we're decarbonising and spending our 3 million on a heat pump, is ensuring that we are thinking about the future risks that climate change will hold for us in different areas. And this is another question, but I thought it'd be interesting to ask the question that the risks in different parts of the UK, thinking of the UK specifically, are very different. And this is something that I'd be interested in, in McBains' work on, and local authorities and the NHS's work is when we're delivering projects in the southeast of England, for example, whether it's an urban or a rural type environment for a trust, be very different environment and future risks in 10 to 15 years to one that might be delivered in the northeast or up towards Scotland. So there's that kind of, it is a local issue now, whereas I think even probably 2 to 3 years ago we were thinking of climate change as mainly being a risk for the broader global population, whereas now I think the last couple of years have proved it's something we really need to have front and centre of our projects now.
Tassos, that's a direct question to you now. I'm just going to sit here and listen to you discuss
it. It is indeed, but I think I'll take it one step back. When we're looking at risk, we can discuss risk in... Risk is a factor that will not make you deliver what you would like to deliver. So it can have many different flavors. At the moment, for example, the application of sustainability or the role of a net zero coordinator that we have occupied for Brighton, I think is one of the first times this has been applied, and I'm very proud for it. But it is at this stage is of a monitoring officer, not a policing agent, that can actually assess and evaluate different decision-making processes. For example, when was planning permission allocated? What is the compliance requirements for that estate? What is the risk because of the ever-changing landscape of pricing? We have geopolitical tension and friction. We have the increase in material prices. The budget envelope might not be able to sustain even the original plan. What is at the core of that service? Delivering a building or infrastructure that will enable people to deliver these services to other people in need. So the role of sustainability almost becomes the role of a risk assessor per se. You cannot be the jack of all trades, but all the elements that we're evaluating, the impact of the materials, the potential for flooding, going back to Richard, for different locations, enabling the estates to have a detailed modeling of the buildings and digital files that can actually use in the future to go back and see what we have installed where, for what reason. These are all covered within the kind of concept of sustainability. Again, I would like to see in the future sustainability being integrated into the standard delivery service. It always has become this exotic element that somehow you have to, you know what I mean? It's a different kind of mindset. The mindset is that if we can apply the best we can today, then we need to be able to do that for especially critical infrastructure as the NHS. Now, the risks in terms of The outdoor conditions or the natural environment or physical phenomena or changes within the energy and gas infrastructure and our networks, the potential risk of losing a power station, you have 2 points of connection of the hospital. These things are evaluated. There are inherited a lot of risks within the healthcare, let's say, but we're trying to navigate that landscape. And again, one of the tools is sustainability, the new hospital program, the fact that there is a standard now from the NHS on net zero buildings, even though it's more focusing on the new, you can extract the messages from the existing. The estates are putting strategies together. The more we can see, the more we can analyze, the more we can understand, the better we can advise. So I think, even engaging on that journey for the benefit of understanding better what exists in place and how you can improve things, it's very valuable, because I'm going back to widening the horizon, scanning of sustainability. People think, I will never be able to claim that I have been, BREEAM outstanding and I have installed all the, biodiversity back to the site. You might not be able to, but you might be able to do something equivalent, or you might be able to be better informed in the decisions you make for your future development plans or investment plans. And this is where the risk becomes an opportunity. That's what I think.
I paused then because I thought you were going to say something else, but it was a question. It was the end of the sentence. I get it now. Lots to think about here. I think we've got to let's just home in very briefly, because I think you artfully dropped the title of net zero coordinator into the conversation, which many of the audience might not have thought about, or they may be wondering, what that is about. So you've appointed somebody for this project that is monitoring everything to do with net zero. Is that right, Tassos?
So
And is
yes,
this? Are you trialing this for a rollout? On how's this?
so as
Yeah.
part of the NHS net zero standard, there is a definition of different roles in the process. So it was very important for these initial stages of trialing the standard, because it's going through multiple iterations as the years progress based on the information that the NHS is collecting to enable decision making. So they have introduced the net zero coordinator kind of description, because we were involved with the Brighton 3T Stage 2, the cancer center, and it's part of a new hospital program. There are elements of the net zero standard, applying the net zero standard or the concept, or identifying how it can be applied. I'll caveat myself by saying, because this is such an early pathfinding exercise, that doesn't mean that you have to fulfill the standard. We need to actually confirm that the elements work, or how they work under the limitations that we have to face. It's a historic project. It has received planning many years ago. So we discussed with the client. They're very open to the idea. They said, it will bring value to their thinking process, and choreographing the all the design teams and understanding how they fit within the general thinking of net zero. So yes, we discussed with the client, and I have installed one of the McBains specialists and myself, actually, as part of the process on the client side, on Trust's behalf, to be the net zero coordinator. What that means is, at these early stages, trialing the tools that they have been produced as part of the net zero standard application, which is a PM tools, or a quantification of impact tools. I'm not going to dive into extreme detail, but I think the most significant part of that role at the moment is that we are able to connect the dots. So we say, okay, this is a decision that was decided upon these parameters and factors for this particular system. Why? How can we report it? Can we better it? How does it fit within the BREEAM requirement? How does it fit with the local authority planning requirements, connecting the dots? So it's a very important role, because it allows you to see and, as I said before, connect the dots. It also supports the client, because you don't have to understand everything that is going on. It's impossible for someone delivering a service as intense as healthcare to be able to have in-house all the specialisms required for why my piping is so big and why I have so much, capacity left on site. So we're supporting them with that. But I think, early days.
Yeah.
Hopefully, as we go towards the stage 3, stage 2, stage 3, stage 4, and later stages of RIBA, we'll be able to actually give the evidence back to the new hospital program and inform them on the application.
Okay, thanks. There's a question coming, not surprisingly, it's about cost. How much is cost, the pressure of energy costs particularly, how much is that putting a pressure on the sustainability drive? Richard, do you want to take that one first?
Well, from a policy direction, we do see, for example, policies in Germany and some other European countries that are incentivizing or de-incentivizing the consumption of gas in favour of electricity. So that'll be an interesting development in the UK to see if that gets taken forward potentially by a new government. Because that is absolutely critical to the acceleration. One of the points of acceleration of heat pump technology, for example, is that certainly when I was looking mainly at retrofit projects rather than the new build, it can be difficult to install all of the building fabric measures you would like to ideally on a building from the 80s or 70s, 80s, 90s. And so therefore, on the face of it, installing measures to heat decarbonisation measures in existing estate can look expensive if you can't show that payback on the direct energy use. So we've covered the point that we can show other benefits and monetize things in a different way. But I think that the cost, the area of cost is from a delivery of project point of view, and I think my experience is mainly in retrofit. I think now the argument is more to invest more in a complete whole building approach in retrofit rather than what we've done historically, which has been to pick off individual streams of work like LED lighting, or we're going to look at building controls, etc. Because you can express the cost benefit of the whole project and manage the transition better. So it's a difficult one, but I think my message is probably to be brave and bold and really dig into all of the cost benefits you can gain from the project rather than something individual, because at the moment probably those individual project gains are falling over, and you can end up probably going right down to an individual stream like we used to. Okay, it looks like the LED lighting can pay back within 5 to 6 years. Let's just do that for now. But then you leave all of the more difficult investments out there. But yes, I guess I guess I don't have a particular view on future, the future hedging on energy costs, but it looks like the landscape is that gas is becoming more and more risky, and there's more and more reasons to invest in the electricity, and particularly, if there's availability, striking up some deals for PPAs, direct line energy, electricity supplies, and obviously on site as well is becoming more and more attractive.
It's interesting, Richard. Yeah, in a conversation I had last week was I asked my general question of what do you? In fact, I've already referenced it. What do you see as a low hanging fruit in low carbon? And their immediate answer was change your electricity supply contract, which is it depends on what kind of business you are and what your framework is as to how easy that is. But it's an interesting one because I think we're guilty as an industry of getting very excited about the new technology that's available, and sometimes we forget that some sort of administrative improvements are also part of the mix. So Tassos, what do you think about that? About the costs? Is this where we refer to the cost, the triangle that we've come up with, which is cost, risk versus reality? Is that right? We were trying to trademark it, weren't we, yesterday?
Yes, I think people naturally, when they make decisions, they think, how much is going to cost me? What do I get back? And then if it's something complex, how do I do it? So, these are the kind of key questions. I think cost is it's a little bit of a dark art, I think. It depends on how you look at it. And I'll explain myself. The energy prices, they have been very volatile. Historically, for example, a lot of the investment going into renewable energy would be associated with the price of electricity. So one would question the system and would say, so I'm getting penalized for using the right product because the other product is polluting it's not the polluter that pays, it's actually, me that I'm trying to do something better that I have to pay for the one polluting. So there was always being disparity between electricity prices and gas prices because one is based on the other. And we have seen recently, the exposure that we have to this volatility. For example, if our historic electricity producing network would still use gas for its majority when the price hike was for gas after the war between Russia and the Ukraine, then you would be facing humongous challenges. But yet now, price, it has increased a lot. Now, without making it too complicated, if I was a consultant, I would say, 2 years ago, okay, electricity is 18p, and therefore, you need the COP of a heat pump of 4 to afford it because gas is so cheap, it's 3p. So, for the technical people in the audience, and now I can see 38p for electricity. I'm like, oh my God, even a terrible heat pump can deliver you benefit. Now, that does not make it any different from saying, I'm looking at a very, very tiny fraction of the life of a decision. And I could not agree more with Richard by saying, we definitely need life cycle cost assessments. We need whole life carbon impact assessments. We do need scenarios appraisals. And then we can identify the inherited benefits of some decisions or disadvantage of others. Cost is the way to quantify the impact of one of your decisions. So you have to make the best decision with what you have in place. You don't have unlimited budgets. No one has, and no one will ever have. But I'm certain that within a budget envelope for capital works or for whole life assessments or for the operational stages, we can find the optimum solution. It just takes a little bit more time and some more options to evaluate. And as Richard said, you decide on the benefit of something today because it can return the investment. You return the investment of the purchase and maybe you save some money in the way, but you don't associate that with the kind of avoided cost of something else, your impact, your loss of land, your pollution of the river, the fact that you're going to have fish. We're not going to do this type of analysis. It's humongous. We're not doing this type of analysis, but there is elements of decision making that supports the investors and business plans and business cases. And I could not advocate more for whole life assessment, both for carbon and cost. If it's done well, I think it allows people to decide, to have better ways of deciding as to where they should invest the money they have. So yes, cost is critical. We need to put in context as to what we're trying to deliver and why. So I said the dark art.
It's a dark art, and that's why many people are employed in cost consultancy throughout the NHS. From my point of view, I think one of the interesting things is that the public sector decarbonisation scheme has been great for the sector. It's allowed some great projects to take place, but in a way, those are big projects, and those can be exciting, and they can be allow great new technology, but you can't allow that to distract from the fact that there's plenty of existing estate that also needs refurbishment that might not have access to that funding. And it's kind of like, okay, those are flagships, great, let's talk about them, but let's not kid ourselves that that's going to be reproduced throughout the estate. We've got to come up with equally practical and, dare I say, economic ways of improving sustainability. I wanted to touch on something that you mentioned because it's a very live issue at the moment, and I think not necessarily well understood by everybody. Embodied carbon. This is becoming, everybody's talking about it. It's becoming a big thing. Plenty of people talking about it. Not so many people know exactly what it is, and certainly not so many people know exactly how to measure it. But many people are asking for it. Many people with a sustainability in their title, I think. what's the view in terms of, when you're going into your project, Tassos, are you setting an embodied carbon target as well? Are you demanding that, or is the client demanding that?
We certainly consider embodied carbon within our decision-making processes. I think I can simplify embodied carbon. I'll try my best.
Yeah, that's a big claim, Tassos.
It is a big claim, but in theory, if everything was to be produced using renewable energy and minimizing the impact of other emissions and therefore the impact to the environment from raw materials to the more processed materials and manufactured goods that we use, then embodied carbon would be irrelevant really. But then we would talk about energy wastage and energy efficiency. Embodied carbon, in essence, it demonstrates that the kind of choices you make, let's say for material choices, because I don't want to cover the whole life at the moment, but let's take it at the sometimes we call it like capital carbon, upfront carbon. It has many different names. What it means is like, okay, where has been your material coming from? Okay, it has been extracted from that place in the world. And they use this type of processes with coal-powered factories to manufacture my secondary material that I want to use. And someone brought it here with a boat, and then the boat took a train and gave someone on the side, put it together. So all of these actions, all of these processes in the background as part of your supply chain or your choices, they have a kind of a footprint, an energy footprint and an environmental impact, which is in a way, in simple terms, the concept of how this energy has been associated with carbon. So what we're trying to do is inform our decisions, because sometimes, for example, choosing materials, equipment, or systems that they have been so harming to the environment through their processes of how it was produced and the amount of carbon they accounted during their kind of manufactured life or goods or transportation, might, to save some energy during the operation, from your energy that you use, the net calculation might not work. Then you might have polluted so much by bringing all these great materials in place that they save you some carbon during your operations, your energy, but they have been so damaging for the environment that you actually, in a net position, you're damaging still the environment because you'll never recover the damage that you have done. So that's a kind of mindset behind this, like in a more simplistic term. So it is important to evaluate this. And also it's important for another reason as well, because it informs the supply chain. It allows for decisions to be made based on kind of maintenance requirements, understanding better the product, because sometimes, we install a lot of new things, and I won't touch on retrofit as well, but then no one knows how to fix them, how to use them. They're just like staying there, never to be used again. One part of them fails and no one is using it. So all of these considerations, they can be linked back to that journey of understanding embodied carbon, our choices. And another third point that I want to make on embodied carbon, it's also it allows for local supply chains to be introduced, because you're not having as your own criteria how cost-effective material might have been that was produced on the other side of the world by a government that you don't benefit from giving the money to, and so on. So by optimizing the local supply chains also give other social value elements to enhance your local economy, the employability of people in that supply chain. Very light touch on retrofit. It's one of my favorite topics, and I can speak for hours, but hours we don't have. So one very light touch is, we have spent carbon or energy producing assets before, and the majority of the assets we have in this country are existing assets. We have 29 million buildings. It's significant important that we actually, take advantage within brackets of this carbon expenditure that we have occurred in the past and reuse or try to optimize the use of what we have in place. We don't have to actually, excavate a whole new site on Greenland to put all these new materials. Existing assets, existing estates, existing buildings, if done well, if retrofitted appropriately, can be one of the biggest opportunities out there, because they are there. We know how they behave. We know how they function. we have now the knowledge and the understanding of like retrofitting and refurbishing. You can use any word you want effectively, and they're long-lasting assets. So every new building will become existing the next day after we actually deliver to the client. So, so it's very important to acknowledge embodied carbon, or the concept of circularity and reuse of materials or expansion of materials and so on. Putting a full stop, and I'm handing it to Richard.
Take the baton on embodied carbon. So I think there's one real advantage for the client of being able to express embodied carbon with at least some level of accuracy that's beyond just carbon emissions factors that might be related to spend in a sector, because the client is reporting on their carbon emissions on an annual basis, and a big part of that is everything that they're procuring, not just in construction but across the board. And from the 2 or 3 recent annual reports that I've seen on sustainability, then construction and medical devices are the 2 areas of carbon emissions within purchasing that are increasing, because there's been a bit of a rebound factor after COVID. Trusts and other healthcare facilities are spending more, I think, or have spent more on construction probably in the last couple of years on a range of different projects, but they're not always able at a aggregate level or an annual level to express where they've made those really good decisions that Tassos is talking about and been able to reduce embodied carbon within their reporting. So there is an advantage to the head of sustainability in NHS trusts to be able to first express where you have made decisions to reduce your embodied carbon, because you can show the evidence. And I think the other advantage of going into embodied carbon is that by definition you ask a question of your supply chain of how materials are being produced and where they're being produced, which brings perhaps a lot more flexibility and a lot more dynamism to your decision making in general, because not only would you then potentially discover other environmental impacts that are going on, and that would reduce your risk longer term, but you've got the same on social risk. Particularly thinking of renewables and the low carbon sector that Gemserv works in. We're doing a lot of work where we're looking at the new technologies, so not necessarily on heat pumps and the heating side of things, but also solar PV and wind turbines. Then we've seen there's been a lot of news of how recyclable the different elements that have gone into those technologies has been, and an increasing awareness of understanding what the full life cycle of those items are. And so I think it's just a mindset where we see the value of looking into the emissions and into our supply chain and the whole life cycle in more depth. And something I was going to add previously, sort of into the cost question, is okay, why should we be looking at all of these things? Is that every reduction, I might be putting my foot in here, but I think every effort to reduce embodied carbon, every effort to introduce a piece of innovation that's going to reduce our carbon emissions or energy demand in the future, are pieces of gold that can be picked up and expanded on by the client, by the person, the team delivering the innovation, and for UK PLC to talk about, because it brings our position in the global market. We have additional innovation that we're bringing in. If we only rely on the sorts of data points we've had in the past, if we only rely on the sort of what has been perhaps the cheapest way of getting through, it's not innovative, and it's not going to drive us forward. So completely understand the balance between how much we can actually spend now and what the benefit is. But if we don't have some sort of innovation and pushing the envelope a little bit, then we're certainly losing the opportunity of doing these big projects.
Don't think you're putting your foot in it at all. I think that's a very valid and optimistic view. It was interesting in that context. We were at an event where we heard from Lord Markham, who's in charge of delivering the new hospital programme, and many of the people in the audience were asking, or were keen to know, whether the money that had been promised, or the money that's available, would still be available in a change of government. because of course that's what stimulates innovation, to have new projects. And his response was, well, they're not getting any, the buildings are not getting any newer that exist at the moment, so something has to happen. So I take that as a positive, and then that means that, you know, we will have these projects where we can demonstrate innovation, which takes me nicely. We've moved very swiftly into the last quarter, and one of the areas that I wanted to get into, because I know Tassos is going to have a view on it, is to ask what the most exciting potential sustainability measure that we can bring into healthcare is, because that gives you a chance to talk about the project you're excited about that you mentioned earlier as well. So take it away. Give us 5 minutes on your new project.
I'll give you maybe a little bit less, and I think
Okay,
I'll
3
be a
minutes.
little bit diplomatic here as well, if you may, because innovation, the way of thinking outside the box or discovering something new, is most of the times associated with risk. You know, there is specific rules from the NHS healthcare estates, health technical memoranda, regulations in place that allow you for some flexibility, but these are long processes. And sometimes, you know, and sorry for going through a full cycle here, I'll come back to the point, I promise. You have procurement rules as well for public procurement and other limitations. For me, the most exciting part in terms of the projects I'm working on and within the concept of innovation is that there is awareness and there is transparency, and we see that tools that have been developed and tested are now being actually used in real life examples. Not only technologies, only it's monitoring, it's understanding the value of an energy and thermal model very early in the design life of a new project, or mapping properly the previous existing property in place. Technologies, innovation would be, successful innovation would be a technology as well that people can operate and use it. It minimizes the risk. You know, it's not only something that sounds very great on the paper and then no one can use. As a fact, you know, healthcare estates, especially hospitals, big hospitals, have a lot of hot water demand, and there is like this kind of concept of can we improve insulation, because the comfort to the patients, that reduces the patient time in staying, but we want more hot water. Can we store hot water smartly? Can we have combined systems and so on? So I think there are parts of its process that you can add value by bringing some of the latest thinking in and evaluating it against the older thinking. And that's, for me, is the most satisfying part, is the greatest innovation, you know, when you break it down and you see, you know, these 5 actions will actually contribute to the best of the outcomes for that project. I'm a big fan of new systems and extreme gadgets. I would not apply them to a hospital environment straight away, you know. I'm also
Fair
an
enough.
engineer,
Yeah.
I'm risk averted, but yes, we have seen innovative materials like phase sensing materials, new technologies for storing like heat in chemical bonding in different systems. They have not been deployed. I think they're part of that future risk diversification of technologies and understanding the risk profile of the estates. All of them connect together. You know, you cannot have multiple different choices in different parts of the estate and then no one knows how to manage again. So this golden thread, I think, is the innovation we're getting to, and sustainability is actually supports the progress of that thinking, which is best practice in my mind. So that's the most exciting part of my days, is like problem solving, a little innovations, right, left, and center.
Are you avoiding mentioning your current project, or have you forgotten
no,
to mention it?
I'm not. We have been actively working, as I said before, on Brighton 3Ts. Historically, I've been associated with Monklands and Gosh, and we're looking at some other projects as well. Of course, you know, different knowledge obtained from different sectors can be transferred across. It's a new thing for NHS as well. As I said, is the latest 2 years that there is a lot of development on their kind of commitments in writing or you know, as law. So yeah,
And the buildings are changing, aren't they? The buildings are changing. We heard this yesterday, that, you know, there's more digital consulting rooms, for instance, being thought about, and the occupant is very key.
The layout is changing, and I'm going to leave some minutes for Richard to come in as well. But I think, you know, The digital revolution, the ability to monitor more things, data is gold, but also knowledge is. So you can be data rich and knowledge poor. So you need to connect the two. So, hand to hand, I think it's a handshake between technologies.
That's a good handover to Richard when you talk about
Yes.
data as a consultant.
Yeah.
So.
Yeah, so the we are tempted to think about big hospitals and how those are going to be converted, but there is a huge amount of activity to develop community diagnostic hubs. There's a huge amount of interest in the GP primary care networks on sustainability, and I was, I think the exciting part that I see in sustainability is the rapid increase in knowledge around environmental impact that is there in the clinician network, as well as the human resources and finance areas of the healthcare system. And what's great is to see workshops where we start to talk about the whole impact of healthcare. And within a workshop that can actually just be presenting what an organisation's carbon emissions are, when you dig down and understand where those might sit and where those can be improved, you start to get a welding together of, okay, well, how can we improve the data that we get on X and Y that will also help us to reduce our carbon emissions? But also, how can we use digital means to deliver healthcare more efficiently now? And you start to see sort of paper processes disappearing within a half-hour discussion around a table, just because the right people are in the room and they've been brought together to talk about sustainability, which is generally a very it's a collaborative subject rather than a competitive subject, and that's the wider opportunity is the collaboration in local environments that I think is what we're going to see in the next, especially with integrated care boards, more working with local authorities, and there must be a drive for increasing skills around delivery of low carbon solutions, because who on earth is going to be available to do a full fabric efficiency assessment of all of these new diagnostic hubs, or retrofitting all of our GPs practices, and also to think about the design of those, the refurbishments to increase active travel, to enable people to move around more. So all of those things is all about education, but it's also about driving the passion to take on that education in the first place. So that's maybe a topic for another webinar.
I always like it when a panelist gives a topic for another webinar so I don't have to think of them. Very good. So we're in our last minute or two. So my traditional end to these panels is to say, what's the one, if we're going to boil it down to one key takeaway for the audience, whether client end or supply chain, what would that be? So I will go with Tassos and then Richard. So Tassos,
I would say the one thing you have to keep in mind is that knowledge is power, and sustainability is part of the knowledge journey, and to optimize these things. So don't be scared, connect with your colleagues, connect with us, and there is definitely solutions out there that can satisfy even the most strict requirements.
I very much appreciate the connect with us kind of payoff there, which is very clever.
Connect yourself as a stakeholder.
And others are available. But you're
I did not. I don't mean McBains explicitly. I said as with us, everyone in that sector.
Collaborate and connect. Yeah,
yes.
I'm just teasing, of course. Richard, what's your concluding remarks?
Yeah, for me, I think we still, everybody has a bit of a journey to go on to understand each other a little bit better. So for the supply chain, as much as possible to try and understand some of the stakeholders' interests who perhaps aren't their normal point of contact. What is the future thinking? What's the current thinking on delivering better healthcare? And then probably on the client side, reaching out, even if a future heat pump project might not look financeable currently, reaching out to the designers, the installer network, to understand more about the technology and to get a little bit more familiar with all of the considerations to deliver sort of a more holistic solution, working together before you actually get to the point of needing to put the tender together and the designs.
Great, thank you very much. Well, thank you, panelists. and I can promise that we will be returning to the subject, and we'll be hearing. I'm sure we'll be hearing from you either in content or in webinars in future, but there's certainly subjects to return to. Fascinating discussion. Thanks to the audience for listening in. As I always end, the webinar will be available to view shortly, so tell your colleagues at elementaldigital.co.uk in hours, if not tomorrow. And if you're not already, please do follow Elemental on LinkedIn. Sign up to our newsletter for all the latest updates and news and more webinars. On which note, the next series from me is district heating, which is next month, and that includes a couple of sections on making good use of waste heat. And that's an element which is also pertinent to healthcare. So it's all going to be interesting. So check out the events section for more details. And that, ladies and gentlemen, is it from me. Do enjoy your day, and we will speak again and see each other again soon. Thank you very much. Goodbye.